Hello everyone, my name is Wu Chunling. I am from the Department of Rheumatology and Immunology in the First Hospital of China Medical University. We're happy to have the chance to learn with all of you. The topic of this class is on RA. I believe that the majority of you have heard of this disease, but do you remember when or where did you hear of it? What's the rheumatoid arthritis? Today, let me introduce it to all of you. First, let's see the concept of rheumatoid arthritis. Rheumatoid arthritis is a chronic inflammatory disease, and it is a symmetric peripheral polyarthritis. It is the most common form of chronic inflammatory arthritis. The etiology of it is unknown. It often results in joint damage and physical disability. Because it is a symmetric disease, RA may result in a variety of extra-articular manifestations. The common extra-articular manifestations include fatigue, subcutaneous nodules, lung involvement, pericarditis, peripheral neuropathy, vasculitis, and hematologic abnormalities. In the past 2 decades, a wealth of basic and clinical research achieved great development. We have gained lots of insights on the diagnosis and management of RA. Serum antibodies to CCP are routinely used along with rheumatoid factor as a valuable biomarker of diagnosis and prognosis. Advances in imaging modalities such as ultrasound and MRI, have improved our ability to detect joint inflammation and destruction. The research of RA has focused mainly on the identification of new disease-related genes and further deciphering of the molecular pathways of disease pathogenesis. With the advances of deciphering these different mechanisms, the new class of highly targeted biologic and small molecular therapies have appeared and benefited lots of patients with RA. Despite these gains, incomplete understanding of the initiating pathogenetic pathways of RA remains a cerebral barrier to its cure and prevention. In recent years, the frequency of crippling arthritis has decreased remarkably. Much of this progress can be owed to the expanded therapeutic ways and the adoption of early treatment intervention. With the shift in treatment strategy, a new mindset has been gradually accepted by general practitioners. That is early referral of patients with inflammatory arthritis to a rheumatologist for prompt diagnosis and initiation of therapy. Many patients have been benefited from it. Next, let's see the epidemiology of RA. RA affects approximately 0.5 to 1% of the adult population worldwide. There is evidence that the overall incidence of RA has been decreasing in recent decades, whereas the prevalence has remained the same. Why? Some scientists think that it is because individuals with RA are living longer. The incidence and prevalence of RA varies based on geographic location, both globally and among certain ethnic groups within a country. For example, the Americans have reported prevalence rates in some studies of nearly 1.3%. In contrast, many population studies from Africa and Asia show lower prevalence rates for RA in the range of 0.2 to 0.4%. The age is also related to the incidence of RA. Different populations shows the different incidence. In specifically speaking, The incidence of RA increases between 25 and 55 years of age, after which it plateaus until the age of 75, and then, over the age of 75, the incidence of RA decreases. Like many other autoimmune diseases, RA occurs more commonly in females than in males, with a 2 to 3 to 1 ratio. Different from above, studies of RA from some of the Latin American and African countries shows an even greater predominance of disease in females compared to males, with ratio of 6 to 8 to 1. How to explain this predominance of females? Various theories have been proposed to explain the possible role of estrogen in disease pathogenesis. Most of the investigators showed that estrogen plays a role in enhancing the immune response. Some experimental studies have shown that estrogen can stimulate production of tumor necrosis factor alpha. It is a major cytokine in the pathogenesis of RA. Above is all my serine contents. In summary, rheumatoid arthritis is a chronic inflammatory disease marked by a symmetric peripheral polyarthritis. Because it is a systemic disease, RA may result in a variety of extra-articular manifestations, including fatigue, subcutaneous nodules, lung involvement, pericarditis, peripheral neuropathy, vascular and hematologic abnormalities. So far, the etiology is still unknown. However, in recent years, great changes have taken place on the contemporary paradigms for the diagnosis and management of RA. The last 2 decades have witnessed a remarkable improvement in the outcomes of RA. That's all for today. Thanks for your listening.